extremely safe, appropriate PPE, gloves and eyewear. The patient is given consent for us to assess them. The patient is in a position of comfort sitting upright. If this patient was having a stroke, we would perform a fast assessment, which is face, arms, speech and time. Once we've completed that assessment and ruled out that they're not having a stroke, we would then go through the AEIU tips, which is alcoholism and acidosis, epilepsy, infection, overdose or underdose, uremia, trauma, insulin, psychosis and or stroke. After we've completed that assessment, we will do a blood sugar level. So we'll need our strips, sharps container, lancet and glucometer. We would ask the patient if they are happy for us to perform a BSL assessment on the patient. They have given us consent. So what we'll do is we'll put a strip into the monitor, take off the little purple bit at the end of the lancet, prick the patient's finger, 1, 2, 3, prick, place the lancet into the sharps container, and we will then draw some blood onto the strip and a reading will come back on this strip. The normal readings for this should be between 4 to 8 millimole. If the patient is aware that that is normal, we'll then place them back into the kit. Now we'll go through the GCS scale. So the patient is eyes open, so that is spontaneous, as of which gets a 4. 3 is to voice, 2 is to pain, and 1 is none. They will then get a verbal response. The patient is alert and orientated to time and place, so they get a 5. So far we've got 9 out of 15, with 4 being confused, 3 being inappropriate words, 2 incomprehensible sounds, and 1 none. We would then go to motor response, and the patient is obeying commands, which is a 6, which gives us a total of 15. 5 being localises to pain, 4 withdraws from pain, 3 flexion, 2 extension, and 1 none. So we do have a GCS of 15. Now we will perform a pupil assessment. So what we'll do is we'll instruct the patient that we're going to shine a light in their eyes and see whether the pupils are equally reactive to light and their size. Okay, I just need to shine a light in your eyes. If you could just look straight at my shoulder. So the pupil size is a 3 millimetre and they are both equally reactive to light.